Hi Sharon, it's so good to see you. How are you doing today?
I feel really good today.
I'm glad to hear that. What's something that has improved since the last time we met?
I told my mom.
Sharon, that took a lot of courage. You were concerned about how she'd react. How'd it go?
It went really well, actually. We had a long talk, and when I told her I tested positive for HIV, she burst into tears. But I explained to her that I didn't have AIDS, and that I was going to be okay if I did everything I was supposed to stay healthy.
Staying healthy really seems to be your goal in dealing with HIV. How'd you feel it all went?
I realized that my mom loves me and my girls, and she has never let any of us down. It felt so good to tell her. I felt a huge weight lifted off my shoulders. I really need my mom by my side right now.
I'm glad that your mom is supportive and you were able to share this with her. You reached another goal by telling her, which was something you wanted to do before linking to medical care. Once you commit to something, you really get it done. Now, how are things with Charles?
I don't know if he got tested or not. In fact, I don't even know where he is. He just stopped answering my phone calls and coming around after I told him I'm positive. I hope he gets tested, but I guess there's not much sense in worrying about him since he won't, talk to me. I have to focus on myself now.
You're right. It's time to focus on all you can do to stay healthy, like you told your mom. So tell me, how are you feeling about getting linked to a medical provider?
I want to, but I work as a secretary for a small accounting firm, and they don't offer benefits. I can't pay to see a doctor. I don't have money for that. All I can afford is checkups for my kids.
I know you're dedicated to taking good care of your kids. Part of staying healthy for as long as possible is taking care of yourself and seeing a medical provider and seeing what options are available to pay for this care. Do you remember when we talked about the options for people that don't have health insurance?
Oh yeah, I guess I have forgotten about that. Can you tell me what options there are?
Of course. There are programs especially for people living with HIV. Medicaid and Medicare fund programs for primary health care services, supportive services, and prescription medications. Here is a fact sheet. Here's a fact sheet that provides the kinds of services covered for persons living with HIV and AIDS, as well as the eligibility criteria. You may qualify for one or for both, even though you're currently working. Let's explore some of these options to see which one you may be eligible for.
That sounds good.
There are also clinics and community health centers too that provide low cost or no cost health care. Okay, and here's the list of some of the facilities and resources that are available in this area.
I didn't realize there were so many options for people that didn't have insurance. I mean, I knew, about public assistance and Medicaid, but I didn't know there were other programs too. I like to read this through in detail at home.
So if you want, in our next session, we can talk about what you think will work best for you once you've had a chance to look over the information. But remember, we have a total of 5 sessions together, and this is our 3rd one. We can meet 2 more times.
I know. It's going fast. I want to deal with my HIV and find out more about it by seeing someone. And that's why I keep coming back to see you. I know it's important, and now that I've been able to tell my boyfriend and my mom, I feel like I'm almost ready to make an appointment. I just need to figure out this insurance and payment stuff, I've been looking at some of the doctors that you gave me on that list during our previous session, and I think I want to go to a community care clinic. I've been there before to get birth control pills, and it's close to where I live, so I don't think I'd have a problem getting there. Other clinics that are not around the bus line will be somewhat difficult for me to get to.
Sharon, I'm really impressed with your ability to make good choices once you have the information you need and solve in your own ways to get around the barriers. Like the clinic that you chose. I hope that you can feel proud about that.
I think I do feel that because I know I really want to stay healthy.
I can see that that's important to you. Let's call community cares quickly to see if they're accepting new patients. Yes. Hi. I'm just calling to see if the doctor's accepting any new patients. I have somebody I would like to send over. Yes? Okay. Thanks for the information. Bye-bye. So good news, Sharon. They're accepting new patients. Let me give you their phone number so that you have it. And I know one of the care coordinators, and I would be happy to call her for you. What do you think?
No, not today. I'm not quite ready yet. I want to look at the information, about the insurance and payment options. Is there any way we can talk about this next week?
Of course. You're taking an active role in figuring out what your options are for paying for your medical care, and that's a big step. So let's look at the ARTAS session plan from our last visit, and let's update it with what we discussed today. So you've selected a clinic that you want to go to, and you're going to review the information about Medicaid and Medicare and about the low-cost medical options. Let's write these new activities down in your session plan. Where would you like for me to put these?
I think they should go under my goal of linking to medical care, as part of my work to find a way to pay for it.
That makes sense. So let's add these activities to that objective and goal. Okay. Now remember, we only have 2 more sessions, so it's important that we continue to have you try to meet your goals as outlined in the session plan. So I'm here to help you in any way so that we can get you to the main goal of seeing a medical provider.
Wow, just 2 more sessions.
Yeah, I know. You take in charge of your medical care by getting information, by identifying a clinic that will work for you, and by looking into your payment options. You've also disclosed your status to your mom and to Charles, and all in only 3 sessions.
Thank you, Lisa, for your help. I'm going to follow through with the goals I set so I can stay healthy for me and my kids. Now that I have my mom's support, I feel like I can take on just about anything.
That's a great perspective to have. Using and building on the strengths that you have, using the experiences from your past successes, and the ability to bounce back from your difficulties will really help you take on just about anything. Let me ask you a question. When people say good things about you, what are they most likely to say?
No one's ever asked me that before. I guess they would say that I'm a good mom. I make sure my kids, have the things that they need because I have a full-time job. My kids are also very well behaved. People comment about that all the time. What good manners they have. That makes me proud since I've raised them by myself since they were babies.
Being a single parent is tough, and your ability to give your kids the values that you're proud of, that people can see and appreciate, is a real achievement. Can we add currently working daily and parenting 2 children to the skills section of your strengths assessment form?
Yeah, I hadn't thought of those as being skills before, but I guess they are.
Doing your job and keeping your job shows me that you have a number of skills, Sharon, and parenting your children with good manners really takes some skill and ability. Keep up the good work. So, that wraps up this session. Remember, I'm here if you need me between sessions, if you need to call me. And we're scheduled to meet at the end of the week. So I made out an appointment card for you to take with you. And see you soon.
Thanks, Lisa. I'll see you then.